Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Kelly Felmer, who is a doctorally prepared nurse practitioner who's on a lifelong journey of being healthy and wants that for all people she serves as well. She helps both women and men to be empowered and to take control of their own health. With over 25 years of medical experience, Dr. Kelly guides those in need on a health journey to reverse disease, resolve symptoms, and restore normal function in the body. At Discovery Health Healing Center in Green Bay, Wisconsin, Dr. Kelly and her staff believe that no one has to suffer with nagging symptoms and chronic illness, but also that people have been taught wrong about how to keep themselves healthy. Medications do not make a person healthy, they treat a symptom. So at Discovery Health Healing Center, we focus on the basic function of the body, work to restore normal function at a cellular level, and therefore resolve the cause of the symptoms and reverse the disease process. Welcome to the show, Dr. Kelly.
Thanks, Dr. Gray. How are you today?
I'm good. Long time no see.
Yeah, it has been. It definitely has been.
We met years ago and I heard a little bit of your story, and I'd love for you to share that with our audience today. So tell us your story. What got you so interested in integrative medicine? That's a tongue twister.
Yeah, it definitely is. But so, like for many of us who start doing medicine or health differently, it's often with our own journey. Right. So I have hypothyroidism or Hashimoto's, but that's not where my journey started. My journey started with my family, of course, and truly it's been failures of the medical system in my family, in my mom first, and then in myself, and then also now currently with my dad. And just how we're no longer approaching things in the right way to help people maintain health or to actually find health. So,
and when you say we, you mean like conventional medical model is not approaching, right? Is that what you mean? Okay.
Yeah, definitely.
Just to be clear, you and I, as in we're doing better.
You and I, we are trying to do things differently and focusing on the right things so we can actually make a difference in these people's lives. But I definitely saw my mom's journey, just in a whirlwind from health illness, and she was she doctored all the time and got another drug and another medication, and the IBS and the depression, and then the thyroid cancer, and then the pancreatic cancer, and blood pressure problems, and it just she just ended up with a ton of medication, and she died, and she was only 60.
So sad.
Yeah. So really, a tragedy. And, when she was diagnosed with thyroid cancer, I got worked up for the type of thyroid cancer as well, because I'm told that's hereditary and it's never been in my family at all. Nobody else has ever had it.
Sure.
But medullary thyroid cancer is only 3% of all the thyroid cancers. So I finally got my thyroid checked out to show that I don't have cancer, but I was hypothyroid. And then that started my own health journey.
Sure.
And through that journey of great, just like so many of our patients, we get put on thyroid medication because we feel kind of crappy. We're just getting by and we can't lose weight, but you're so tired, and like, yay, diagnosed thyroid problem. The medication is going to make all the difference in the world. And then you're like, okay, my numbers changed, but I didn't change. I still feel crappy. The TSH went from whatever it was to, okay, you're saying it's normal at 2, but I don't feel good. But we call that good. And, and then they wash their hands of us
and say, there's nothing else we have to offer you. Yeah,
exactly. Or no,
an antidepressant.
Fine. Right. And just like so many of our patients, I went on one. I was in a not so good marriage at the time and thought, you know what, maybe I do need one. And then, wow, did I feel horrible with that? It was not what I needed. I really didn't need that, because clinical pearl, antidepressants don't help correct the other person, right? In a bad marriage. So, like that didn't help at all. So yeah, my mom's journey and then my own journey, and just then being triggered to the point, after autoimmune thyroid came rheumatoid arthritis, and the rheumatologists, just like endocrinologists, are very close-minded, most of them, not all of them, of course, but who my rheumatologist insisted food didn't play a role. I asked multiple times, what about this? This is supposed to be good for the immune system. Will that help? No, don't do that. That'll probably mess up your immune system. Only take this drug, right? Yet I took the medications because I didn't want the disabling effects of rheumatoid arthritis. Like, okay, I know what that ends up looking like. I don't want that. And the reality is, it doesn't stop the disease progression. I needed ibuprofen 3 times a day to not have pain. And then when I complained of um, not being able to bend or straighten my index finger specifically of my right hand, I'm like, ooh, I'm noticing something change. And talked to my rheumatologist about it. And he said, well, when you can't move your finger at all, then you let me know. Right? So that was the big aha moment to say, I'm pretty sure we can do things differently here. Like, that
Yeah.
was not okay. I was in I'm 32, 33 years old. You want me to not use my hand and then you'll help me? Like that, how am I stopping disease? I'm not. Right? So
Mhm.
those were the big moments, watching my mom die, and then, not being managed well with thyroid or, rheumatoid arthritis, which, is managed by food, and I don't take medications. And so,
For the listeners, she's wiggling her fingers and showing us her range of motion, and
yeah, that's right. Not everybody
she's
is.
not debilitated. Yeah.
Yeah, so food matters, all these things from the inside out
Mhm.
matter. And that's when I started to learn things differently and got training, different ways in nutrition, in functional medicine, in herbs, in,
Mhm.
whatever I can keep learning on to better know how the body really works, because we're taught pathology and disease. We're not really taught or reinforced, and we just take for granted that the body works right.
Mhm.
Right? But then
Mhm.
that's where all of our symptoms start coming from. And yeah, so that's helped me, tell people, don't come to me to diagnose you. I don't want to diagnose you with anything. I want to help get things working and
Mhm.
functioning, and then you don't have all those symptoms anymore. So
Amen. Yeah, I think we practice very similarly. So, along your journey, which yeah, thank you for sharing that story, you started Discovery Health Healing Center. So, you approach things a little differently than traditional medical providers and other alternative providers. So, tell our listeners, I think I know what you do, but tell our listeners how your services are a little different. Like you're just saying, I don't diagnose. So, what do you do, Kelly? Yeah.
yeah, and not that I couldn't
Oh, right. Right.
diagnose,
Right.
but, and definitely I value my medical experience
Hmm.
and the knowledge that that's gained, and then I can use a medication when it's appropriate. I
Sure.
just gave someone a prescription for some NP thyroid, and that's okay because she really needs it right now.
Hmm. Hmm.
But it doesn't mean she's gonna need it forever, or maybe not that dose, or we'll
Right.
figure that out as we go based on our body's needs.
Yeah.
So one thing that I've tried to create at Discovery Health Healing Center to differentiate a little bit is not only doing one-on-one consultations to help a person do education, find out their story,
Hmm.
to get the clues of what's happening in their body, so that we can start to support them in the right way and make some changes. But then I offer other services that can complement what I do, and it's all focused at helping the body function normally. So, or looking at it from a cellular function to say, the cells need good oxygen, they need all of the nutrition, they need good adrenal support, they need the thyroid, they need X, Y, and Z inside the mitochondria to produce energy. And if we get that happening at the cell, then that cell is making energy. And if we get all those cells in that organ making energy, well, then that organ's functioning appropriately. So I do some additional services with IV nutrition therapy, giving lots of vitamin C, different B vitamins, of course, and different things. I've added ozone therapy into IVs and even prolozone injections, which I can tell you more about.
Yeah,
I do.
let's go there. Yeah.
Okay.
Not to cut you off, but let's talk more about ozone. So I haven't had a lot of guests mention that yet. So tell us
Okay.
what it is, kind of the purpose of it, how you administer it. Let's go there. Tell us how it's helping your patients.
Okay, so I just incorporated that into my practice last year. It definitely, through different certification programs and training programs that I've taken for IV nutrition,
Yeah.
I heard about it often, especially when I do an IV nutrition for oncology and, severe and chronic illness. And it just wasn't something that, it seemed like it was more work, and I just wanted to get better at what I was doing, and I couldn't wrap my brain around it quite yet, even though I was hearing about it. But last year, after hearing a podcast with Dr. David Brownstein, and he mentioned ozone. And then I was listening to somebody else about something, and I'm like, and they mentioned ozone. And I'm like, gosh darn it, I better,
Learn
you know,
about this ozone. Yeah.
right, like they're doing ozone. And, so got me more interested because, I take a lot of clinical pearls from a lot of those other experts out there. And then found a course that Dr. Frank Schallenberger teaches. Um, and truly, David Brownstein went through Schallenberger's course. So I'm like, okay, show me Schallenberger's course because he went through it. I'm going to see what that's all about. And ozone, when I explain it to somebody I'm working with, when I think it's something appropriate for them, is, I describe as super oxygen. And although, that's a very simplified version of it, but oxygen is O2 and ozone is O3. So it's when oxygen gets split apart and it comes back together, and now it joined as a threesome instead of a twosome. That creates ozone. We are familiar with ozone because we smell it in the air when we get a rainstorm or there's been lightning, because it's that electricity that breaks apart the oxygen that then creates ozone. So in truly, there are people who think ozone is something bad for you because it's measured and reported through the weather service, but it's because ozone is easy to measure in the atmosphere, and the level of ozone correlates with air pollution. So ozone in the air isn't bad, it's the air pollution, but that's more difficult to measure, so they report ozone levels. So
it kind of has a negative connotation from
it
an
does.
environmental. Yeah.
Yeah, and ozone isn't something you want to breathe in directly. That will give you a severe coughing fit that you will never forget. But there are many great ways to benefit the body in ozone being tremendously healing, removing inflammation, and super easy actually to administer, and super great effects for that person with cancer and autoimmune disease, or even post-viral and bad viral illnesses. We're using a lot of ozone and vitamin C because it gives your body exactly what it needs. We burn oxygen, and if we can get and facilitate more oxygen into all of the cells, it proves to be beneficial, helps to kick out free radicals or things that are bogging the cell down, while promoting a healing process. So it's been pretty fascinating. We use it, and it got much more popular much quickly than I was prepared for. We have athletes who use it and who
Sure.
were asking for it, and I'm like, oh, okay, yeah, okay. And it just took off like wildfire, where I was trickling it in with my patients, but then people who know about it look for it, and it's a tremendous healing modality. I do it, along with the vitamin C or not, to keep autoimmune disease, in check,
Sure.
in remission, and, under the best control possible. So I really value it from that standpoint. But we can also administer it rectally. It can be given in the bladder. It can be given vaginally. It can be given in injections. So I also do some prolozone injections where I'm giving nutrition actually, some, a small syringe of anti-inflammatory solution of giving the cells in the injured or inflamed area, that the area that's stuck and not healing, and giving the prolozone there, followed by the ozone therapy. And it's amazing how many times people come back, or only need one or two injections, and how healing that injection was. It helped to relieve the pain, re facilitate better circulation. It helped to increase oxygen and nutrients exactly in the area, and things start changing immediately. So it's been a pretty great addition to the
That's
things that
awesome.
I do.
I already have questions because I'm where you were, although I've been stuck there for like 5 years thinking, I want to bring on ozone. I want to bring on ozone. I haven't had time to get the training, but, and I
Right.
will eventually. But how do you cycle that with vitamin C? Because I assume you can't get them both the same day, or how do you, or you can?
Yeah, you definitely can, and we've done a lot of that when people have an
Sick.
illness,
Yeah.
or when they're sick, or when they're trying to recover. It's just that, oh, I'm still fatigued, I just not back to normal. Definitely, we use a lot of vitamin C for that, which helps tremendously. But now that we have ozone also, you can do ozone first and follow it with the vitamin C. You can follow it with any vitamin,
Awesome.
any IV bag, but we do most often and have a combination of doing the ozone followed by vitamin C is the thing that we do most often. But then we have several people who do the ozone alone as well.
Do
So
patients feel better after one treatment? Like I have some patients who you give them vitamin C and they're like, man, I feel better. Like they
yeah,
do they feel
same.
better? Can they quickly or
Yeah,
yeah,
absolutely.
yeah,
And I have the same thing with people. One person will feel so dramatic, like, wow, that was the best thing ever. And then I'll have the next person who's like,
doesn't
well,
feel
I can't
anything.
really
Yeah. Yeah.
and I'm in that boat. Like, I know I get it and I feel good, or I'll use vitamin C a lot when I'm feeling a little run too thin, so that I don't get tired or that I don't get sick. I'll get a vitamin C, and I feel the difference from the adrenal support of
I do
vitamin
too.
C,
I do too. Yeah.
that
Yeah.
I don't feel worn out, where I could feel I was on the edge of that. So that I noticed. But I'm not one of those people who, like, oh, I got that IV and I feel amazing. Like, no,
Sure.
it keeps me feeling great every day. But
Sure.
yeah,
What I know this is your answer is probably I can't tell you that because I offer individualized care, but for patients with autoimmune diseases and who choose to pursue ozone, like what's the frequency? Do some of them, just from maintenance, not treating acutely, but like from a maintenance standpoint, are some patients doing it like once a month, what do you find?
yeah. So of course, absolutely, you're right that it's individual, depending where they're at on their journey, how aggressively they want to attack what's going on. That'll all depend, but they could get it a couple of times a week to weekly. What I've chosen to do most often, if antibodies are sky high, they're not doing as well as they should be, I would recommend at least once a week, for a good 4 to
Sure.
6 weeks before we go down and get it once a month. And then as I titrate with anyone, if you're maintaining and if you're doing well and if we've got all of our bases covered, we can keep spreading that out and making
Sure.
sure you still keep feeling good.
So you mentioned antibodies. Are you seeing, now that you've been doing this for a while, with autoimmune diseases, like antibodies going down over
Um,
time? Have you
so
been doing it long enough that you're seeing not just
I
symptoms improve,
haven't
but
been doing,
yeah,
I've only been doing it since the end of last summer. So
sure.
it hasn't been long enough. And I'll tell you, in myself, yes, but I've also noticed I don't have a good pulse on that, because I think there's too many other things that have made antibodies go back up, from a vaccine standpoint,
Sure.
from just different exposures,
Sure.
where we targeted it very hard in one particular person that I'm thinking of, and we went, what, like, it didn't change, like, she feels great and everything's amazing, but
Yeah.
her antibodies didn't change. And
Sure.
as we talked through it, those were the only types of things that we could come up with that made things worse, and we
Sure.
didn't see the benefit we were looking at when we targeted it for that period of time, because then, then my husband got sick, and then this, and then we're checking. And so,
A lot of variables and a lot happened over
yeah,
the last year. So not the best. Yeah.
right. So I don't think that's so
Fair
I
question.
wish I could say absolutely. I know that it's helping at a cellular level, no doubt in my mind. Dramatically, we see people bounce right back, from with fatigue and their just sickness, and
Sure.
the things that we do from that standpoint. That's easy to see that it was a game changer and a much more potent tool or combination of tool. And I'd like to see over time it change more significantly in some of the autoimmune.
Sure. Well, speaking of other illnesses, what about biotoxin illnesses? Do you treat patients with mold and Lyme? Are you using ozone for those?
So we do. They're not a big part of my population.
Sure.
And but definitely between the ozone and even UV light with the IV nutrition will be some things that I'll use with people with chronic Lyme and or chronic mold illness, or EBV, things
Sure.
like that, to target through the bloodstream just a little bit differently. But those patients for me are sporadic, so I don't have a routine with that
Sure.
either. And depending where else they've been and what they've done and what they're
Sure.
coming to with.
What about side effects with ozone?
Yeah.
So,
So one thing that I learned, and you'll learn through the training, there it's really safe if you do it the right way. And so there's tons of literature on it, which is pretty amazing too.
yeah,
So that's always reinforcing and good to see. But if I do just major autohemotherapy ozone, which is MAH, abbreviated ozone, which just means I pull 50 cc's of blood, and then we put ozone in your blood, and we let the two of them, we agitate it a little bit, and we watch your dark red blood turn bright red because it's super oxygenated. And once it's reached that bright red point, we administer it back to the person. There are other ways to do it, or bigger volumes, or hyperbaric ozone that I contemplate about as the need gets higher. So we're not at that stage yet. The MAH ozone is just working perfectly
sure.
for us. And I forgot what your original question was.
Oh, just side effects. Just asking side
Side
effects.
effects. So just started talking about how we do it, and then it's perfectly safe that there shouldn't be any side effects. Now, would there be, sometimes, watching for increased bleeding tendencies, or literally I've seen nothing happen.
Yeah.
And safety first from my perspective on how we administer any IV here, and I think that has a lot to do with it. But just like with any informed consent and any risk with just getting, like a hydration IV, you could get infection, you could get
Sure. Sure.
something
Yep.
thrown off. So there is a long list of potentials, and I've never seen it. And all of the mentors that I follow don't usually see them either.
That's
But
good.
there
Yeah.
are some people who directly inject ozone, which is frowned upon because that's dangerous.
Okay.
If you just think about
Inject it.
directly
Yeah.
giving somebody an air embolism, that's the way to
Yeah.
do it. So we don't do that.
Good to know. Yeah. What about
Yeah.
Herxheimer reaction? Would patients get any sort of die-off reaction? Could they?
So I think it depends on how sick they are and what they're
Yeah.
sick with, but absolutely the potential for that would be there.
Sure.
And so starting small and building up is
Wise. Yeah.
good, wise, because
Interesting. Ozone still piques my interest. Okay. At your practice, I know you do something else differently. You offer near infrared light therapies with Thor Medical. And I remember talking to you about this a couple years ago because I knew you got this big new toy, and I wondered, like, I shouldn't call it a toy, but yeah. I mean, it's equipment for your office. And
medical grade equipment.
yes. And I'd like to hear more of what, I guess I'll go back to saying, piqued your interest with
Yeah.
that therapy with photobiomodulation, and explain to our listeners what that is, because I also haven't had a lot of guests talk about that sort of light therapy. So tell us
Okay.
what it is, how you use it in your office, how it's been helpful for your patients.
So if we go back to my story, I started to say failures of the medical system, right? And finding new and better ways to help people. Well, 3 years ago, actually, I think we're going on 4 now, my dad was diagnosed with ALS.
Mm.
And then I got an email about this light therapy, photobiomodulation, and it was about neurological treatments with it. And so I looked at that and I started reading about that and researching about it. And I'm like, we have to,
Yeah, I got to get this. Yeah.
I got to get this. My dad needs this.
Yeah.
We need to do this now. And so, so I jumped in to learn whatever I could about it and how it can be helpful for the body, again, at a cellular level, at helping to balance within the cell, kicking out free radicals or other things that are bogging down the cell, helping to optimize the chemical, processes of creating energy in the cell, balancing the NAD, NADH. So the light therapy, all the good things that we know ozone does, light therapy does too with near infrared light. So it changes things at a cellular level when we absorb that near infrared, just like we absorb the UV light to make vitamin D and how
Mm-hmm.
important that is. We can absorb near infrared light to create changes at a cellular level, and things start to change. So I was prompted and got interested for a need in my family. And
Sure.
that's actually then the thing. At that time, I was doing consultations all by video from my home. And it was the need of getting this equipment that made me open up doors of my own practice with both a full body bed near infrared called the Novathor. And then
Mm-hmm.
we also do local treatments for acute and chronic injuries with the strategy of near infrared light helps to remove inflammation in the
Sure.
area. It
Sure.
helps to increase circulation. We can interrupt the nerve response or the triggers that are sending pain and the muscles that are in spasm for a non-invasive pain reduction strategy. So we've seen over the last 2 years tremendous changes in acute and chronic injuries that just because of the near infrared light, the Thor medical light therapy. And then that's also the thing that pushed me to get ozone and do prolozone, because it's like the next best step to do
Sure.
all of those things.
Sure.
But if we weren't getting enough relief, well, I can go right on in there and give it a little bit more of what it needs to finish the healing process.
Yep.
And that's been working fantastic.
So I hear you say expedite healing process, reduce pain and inflammation. So great for acute injuries, right? But
Mhm.
also for chronic, like, so
Yeah.
I want to go back and hear about your dad. So is your dad using the bed,
So
or how?
that's not a good story.
Oh,
Only because when we got the equipment and then COVID shut down everything, and he has a very chronic illness,
yeah.
so they've never been able to come use it.
Oh, I'm sorry.
Yeah. So it was, and this is the story of my life. Like the epiphany. I couldn't help my mom, and I can't help my dad, but they've facilitated things to help me help myself
And
and to help
lots of
everyone
other
else.
people. Yep.
Yeah.
Yep. It's amazing. Amazing.
Yeah.
I want to come back to this, but I got to digress. So you've been through so much, like that's a lot of trauma. Like, how do
Yeah.
you mentally stay strong? And what are some lifestyle practices that you've used and you've helped with your patients, or you've used to help your patients in similar circumstances?
Yeah.
Tell
It's
us your secret sauce. How do you keep going, Kelly?
because there's always somebody more to help, right?
Yes.
And
Yes.
so that most definitely, and definitely had, a lot of traumas. And even um, part of I didn't go back far enough to include my brother in part of that story, who got in a bad car accident at age 16, which was the catalyst for me to go in this direction.
Wow. Wow.
But that's the first thing, to
Yeah.
say, well, I couldn't help him, but here I am in this field helping people, and then my mom, and then my dad, and then here I am. So,
And yourself. And yeah. Yeah.
right.
Yeah.
So definitely some traumas along the way, and there were some big traumas that impacted me through this journey of trying to do things differently as well,
Mm-hmm.
where I had to take a moment to take care of me. That's why
Mm-hmm.
I did consults at home.
Yep.
I still felt driven and passionate. I can help people, and I just did it on a lower scale for a while because I
Mm-hmm.
needed to recoup.
Yep.
But every single one of those life experiences, of course, and in my consultations, I describe my practice as holistic as well
Mm-hmm.
as restorative. And I firmly believe we deliver that every day, because in my one-on-ones, there's no almost never can we not talk about the stress and how it impacts a person, and getting them to recognize how much it's impacting them.
Mm-hmm.
And there are times they need to quit their job, and they need to hear someone from the outside tell them
Tell
that,
them that. Yep.
right? And
Yep.
so we definitely, I did a lot of self-reflection and helping myself recover, my adrenal glands recover from those traumas. And I think my personally secret sauce is that I'm driven by, just like the story with my dad, to stay positive about that, to do whatever I can
Yep.
to be helpful. And that, that keeps me going, that keeps my energy high, that helps
Mm-hmm.
me feel I'm serving people well. But most definitely, I needed a good 2 years to take some TLC and to walk outside and to breathe
Mm-hmm.
fresh air and to set my feet in the grass and do all those basic things to repair and recover. And I talk about that with my people all the time, and talk about how their stress is their perception, right? And when you wake up in the morning and Williams made a mess, you either let that ruin your day or go,
Yep.
yeah, he made a mess, right? And how many times, and maybe you felt caught or stuck one day, but that destroys people because they're like, again, and it's horrible. And it's just like, really? You know what? It's not that big of a deal. And if you can just change your perception of that
Yep.
stressor, that helps to change everything. So I've found that as a beautifully strong tool that I use for myself and for so many people that I talk to, of helping them get a grip of, what? Crumbs on the table. You see it every day. It makes you mad every day. It makes you have a bad day every day. Is it really worth it? Like, I think we need to let this one go, because nobody died and nobody got hurt, and but yet it's ruining your life. So all of those stress mitigation and self-reflection, helping people come up with a new message. you know I am worthy, looking in the mirror, you are
Yes.
beautiful,
Yes.
all of those things. We talk about those things because those are the core, just as much as eating good food
Mm-hmm.
makes a difference in everything. So that's a piece of everything we do too. And
Does
you can't
the
forget to do it for yourself.
yes. So does the laser light, am I saying that right? Is it low level laser?
Yep, that would be
Is it like,
another name for it.
is that helpful? I mean, as far as, is that kind of like sonotherapy that would induce kind of that parasympathetic calming state or not? Does that?
And so, think about first, near infrared is a
Yeah.
long spectrum of light. So our far infrared saunas
Yep.
help us to sweat, because that
Yep.
far infrared vibrates
Penetrate. Yep. Yep.
cells.
Yep.
And then the near infrared just it gets absorbed differently. And
So do you lay in a bed? Is it like a tanning bed? Like that
yeah, so
yeah,
it looks like
with
a tanning.
clothes on or off or like,
So minimal clothes is recommended. We ask people to keep on their underwear,
sure,
but definitely it's a whole light bed therapy. We have people go in it just for 12 minutes at a time. We start them out small at 6 minutes and work them up to 12 minutes.
sure,
If they were a Lyme's or a mold person, I'd start them out at 3 minutes because they could have some flu-like symptoms or
sure.
Herxmeyer symptoms because of the changes that are facilitated. So we start them out very small. We've also had, someone who's very fair skinned, very pale redhead, that light might be a little intense. We'll start them out small too and build them up, or they feel like they get a little windburn.
Sure.
But even when we start people at 6 minutes, it's amazing how so many of them come out saying, how much better they feel. Getting that little bit of rest is always helpful too. Taking a down moment, hearing relaxing music. But even when we very first started, people would come out and say, wow, you know what? I put my shirt back on and my shoulder didn't hurt. My shoulder always hurts when I put my clothes on. And I'm like, really? I'm like, you were in there for 6 minutes. And they're like, yeah. And that felt amazing. And I go, wow.
That's
And then
incredible. Yeah.
it was pretty incredible. And it's not that everybody feels that, but then I started getting people who, didn't notice anything at that moment. And then they come back and they go in the bed again. And they're like, you know what? I was driving home and I needed to look over my shoulder and I can't look over that shoulder. And the range of motion, just the muscles relaxing and being able to get rid of some inflammation started moving right away. And they felt that, didn't recognize it at first till they did a motion to change lanes in their car. And they're like, oh my gosh, I just turned my head so well. How did that happen? And that was off of the whole body bed, which is great. And now if somebody has a specific neck injury or back injury or sciatic pain, we'll work on it more directly, more concentrated with probes that are able to penetrate deeper as well to facilitate more change to help loosen up their back and decrease that pain, etc. But it's been wonderful for sciatic. Although
Yeah.
I'm also encouraging stretching and, if they were seeing PT and getting a chiropractic adjustment, and it's all, all part of the puzzle, but it's been pretty phenomenal how things start to change.
Very interesting. All right. Are you ready for another question here? I want to go to a third topic.
Okay.
You offer bioenergy testing or
Yeah.
metabolism testing at your practice. So
Right.
tell us what that is, because that's also not something I'm currently using. And tell us how that has benefited your clients.
Definitely. It was, I learned more about it through ozone therapy, again, through Frank Schallenberger. And because he's the spearhead behind it to take, the metabolism testing as he describes and supports with, research was the way to test the thyroid in the beginning. And looking at your oxygen consumption and your carbon dioxide is the exact way to tell how your body is burning oxygen for fuel. So he describes that as oxygen utilization. And when you're burning fats for fuel, you have a specific ratio. When you're burning glucose for fuel at the cellular level, that ratio changes. And so through evaluating a person at rest, just breathing, we do some spirometry testing to evaluate their forced vital capacity, to get an evaluation of how well they should be breathing and bringing in oxygen. I've had a good handful of people where I have to tell them, we first have to work on learning to breathe and belly breathe because they're literally not breathing well enough.
Sure.
And that impacts their whole body. It's not that they need a supplement. It's not that they need a medication. It's that you need to breathe. Like that's the number one thing we have to start with, and that's free. You just have to practice actually breathing better. So that's been pretty amazing, just pulling pieces of how the body works together. But it's taking the information of burning and using oxygen in the mitochondria to produce energy, and looking at the ratio of oxygen consumption and carbon dioxide ratios to know the demand on the body. And then the software that the technology goes through breaks it down further that I can't quite explain, although I've got the information that gives you the formula of how it takes this, and this to come up with this. But it pulls out of that information then a resting metabolism for that person, as well as evaluating how do they have enough thyroid inside the cell to produce energy, and how well their adrenal gland is supported and getting used inside the cell. It gives us an evaluation of the amount of carbohydrates that the person is consuming. How much of an effect is that having on their body's ability to burn fat for fuel? So that's been rather enlightening as well, because with every person, it's different. One person, you're doing fantastic. The amount of carbs that you're eating for your metabolism, for your body, it's fine. Everything's working really well like it should, so it's having minimal impact. To the next person that I'm telling, you need to keep eating these complex carbohydrates, but we need to get rid of these simple carbohydrates because they're bogging you down. To the person where I'm getting a completely different output, where the carbs that they're eating are literally shutting down the body's ability to burn fat for fuel.
And you can
So
see that on this testing and tell them how to change their eating
exactly.
based on that's, yeah, cool.
Right? It's super cool. And it's not about, people come back and say, well, how many carbs should I eat? And I say, no, it's based on how you eat, and you need to keep eating like you are, or you need to cut that in half. You need to cut that. So it all depends on where you're starting to
Sure.
get what that next step is.
So if patients are compliant and they make the changes you recommend, how quickly are they going to see? I know there are multiple variables that are probably contributing to this metabolism, but how quickly are patients seeing results? Like, was this a big needle mover for you when you started using this?
Definitely when I started using it, when we got it under our belt, when we got a few little tweaks out,
Yeah.
I changed things based on mine, let me tell you. I'm like, really? I was feeling pretty good, but mine said I didn't have quite enough thyroid. So I went back up on my thyroid.
Okay.
And my carbs were a non-issue. Don't eat a lot of those, but I changed how I exercise as well. Because not only in, as I described, your oxygen and carbon dioxide ratios and how you're making fuel in your body to have energy, your heart rate gets associated where your optimal fat burning zone is. And so that's been a tremendous game changer as well, to learn when I'm exercising, it's not always more is better, harder is better, because you
Sure.
overdo and you actually go in an anaerobic state, and the bioenergy tells us at what heart rate that is. So even though the trainer told you you need to get your heart rate up above 150, I come back and tell you, well, your body says different. Your body said, actually, you burn fat at 110.
Yeah.
So if you're always exercising above that, you're past fat burning. You're not burning fat. And you wondered why you
Yeah.
exercise harder and you can't lose weight.
And then you're burning out your adrenals and your recovery's poor and you're, exhausted. And yeah.
So
Wow.
it's really helped to mesh and
Sure.
bring information from a functional perspective
Yeah.
to compare along with the labs I may have tested, and then along with what the person is telling me.
Mm.
It more often than not coincides with the person and what they say, but now you have not only their subjective view of their symptoms, you have an objective view. So most definitely I'm rechecking that for some people in about 3 months.
Mhm.
if we need to recheck it that fast. And I've got several people out, 6 months, and I should have rechecked mine by now, but I don't want to yet. I'm not done yet. I want it better when I get back on the bike. And
Yeah.
so I have refused to do it because I'm like, nope, I'm got to keep working on these things I'm working on because I want that to be really good.
Awesome. 3 new fun topics for our listeners. Yeah. Thank you
Yeah.
for sharing all of that.
Yeah,
Well,
it's been great.
tell us more about you, where listeners can find you. Are you on social media? Tell us those
Definitely.
details.
So the clinic is located in Green Bay, Wisconsin, Discovery Health Healing Center. And where our website is dhhealingcenter.com. We have, very transparent. We're out there with all of our information out on that website. Of course, we're on Facebook and Instagram. I don't do much with any of the other social media at this point, but those are things that we'll put little posts or little accomplishments or wins, different things happening for our patients that are changing for them. But those would be the three most the three ways
Easiest
to
ways.
look at,
Yeah. Yeah. To
yeah,
find you.
easiest way to see what we do and where we are and how to contact us.
Awesome. Awesome. Are you one of the few clinics that has one of these low laser light therapy beds? If I
So
said that
what
right?
I Yeah, so as far as the Novathor bed, which is one of the only medical grade beds out there and FDA approved, there definitely are other competitors, but we're the only
Sure.
Novathor in the state of Wisconsin.
Wow.
And then there's a lot of other places that have light beds with green light and blue light and red
Sure.
light. And they claim the same research benefits of the photobiomodulation, which is not true because it needs to be the near infrared light. So I don't know what they're really providing besides a colorful bed.
Tell us your top longevity tip, absolute top, if you had to pick one.
So I think, it's one concept
Okay.
versus being one thing. When you told me that you were going to ask me that question, what I find the most valuable as we took this time to talk about different services and how they work differently within your body. But the bottom line is listening to your body and hearing what it has to say. Because when I'm talking with somebody, if I pay attention to how they describe something, it always gives me the clue. And I actually tell them how much I love it when they gave me all the answers of what their body actually needs. And so it's having a provider first who helps to reflect those things to say, but this is what you're telling me. Yes, that symptom, but that's what it says about your body, about how it's functioning, and gave me the clues to know what to test, but more importantly, already how to support you. So, we definitely find when I've worked with someone for a while, they learn how to better listen. And there's definitely people who listen really well in the beginning. But if we can listen together on the clues that say when it's not right, then it's not right. It doesn't matter that you had this test, you had this, this scan, you had this blood work, you had this, and it says you're normal. You don't feel normal, then something's not working right. And
Mhm.
so if we listen hard enough for those clues, we get the right places to at least start. And then that gives us the launching pad for things to change, and we can hear the other symptoms then once we get the main things out of the way.
Love it, love it, love it. Well, thankful that the world and state of Wisconsin has providers like you, yeah, who are listening, right? Whose
Right.
minds are open, who are listening. So I got 3 words for you, Kelly.
Yeah.
Write a book. You got to write a book.
Oh, yeah. I think you told me that once before, of course, after you were done writing your
Writing, yeah.
book, right? Because you're like, when you were in the midst of it.
Oh, it was very stressful. Yeah. I don't
Yeah,
recommend it to anyone. No, just kidding.
I,
I do. No, I just feel like you have such a story, and thank you for being so vulnerable and sharing your story with us. And I'm sure, I mean, we heard 50 minutes of it. I
right.
mean, we didn't hear the decades worth of trauma and just challenges that you've gone through, but I just think your story is beautiful. And so thank you for, yes, sharing about low laser, I still can't say it, low level laser therapy, ozone, IV therapy, metabolism testing, but just thank you for sharing your story and for staying progressive and for staying out there, being the provider who is just, you're really just seeking to serve other patients and help them get to the root cause of their problems. So
Yep,
world
absolutely.
needs more providers like you, Kelly. Thank you for,
Yep, and you too, Stephanie.
thank you for coming on the show. This was wonderful.
Thanks for asking. I was happy to be here.